Welcome back to the third part of our NHS West Yorkshire Integrated Care Board meeting here in Brighouse. We are now in the last section of our board meeting. Colleagues around the table, as you speak, just a reminder to introduce yourselves, particularly as we have a number of people here in the room today, or we did, observing the meeting, and we do have a notable number of people who watch this meeting live and on record afterwards. So we're now going to move on to item 19, which is our Freedom Speak Up Guardian Annual Report. Kate Sims, would you introduce yourself and give us an overview, please?
I will, thank you. Hi, I'm Kate Sims. I'm the Director of People for the ICB, and this is our first Freedom to Speak Up report as an ICB. I will assume the report has been read. It's hopefully quite straightforward reading, but I just want to make some key points, if I may. And also, Majid Hussain, who's unfortunately had to leave the board slightly early, is our non-exec member, or lead, for Freedom to Speak Up. So Majid has left me with some comments as well, which I'll take us through. So I guess really to start with, very briefly, why is speaking up? Why is the speaking up culture? Why is freedom to speak up so important? I think our biggest point is to really make sure that through our environments, through our working environments, we make it safe for our communities, we make it safe for our patients, that we improve our working environment for our staff. And of course, as we've heard a lot today, that we promote both learning and improvement. So I think anything that you want to see within a Freedom to Speak Up report, it is about sort of what is this telling us. Of course, it's relatively early for the ICB. There was an expectation from NHS England that all ICBs had a Freedom to Speak Up Guardian in place by January of this year. We actually had a Freedom to Speak Up Guardian from the moment we started back in July 22. That was me. I was the Freedom to Speak Up Guardian until we've appointed Jock Crawford as our dedicated focused guardian from now on. So I now have the role of Freedom to Speak Up exec lead, and Majid, as I've said, is the non-exec lead for this subject. Hopefully what the report gives you is a bit of a progress report for the ICB about, obviously, yes, appointment into roles, but also around the promotional work that's been going on around the Freedom to Speak Up agenda. We reference this in every communication, every staff briefing that we have regularly as an ICB. And as many of you will be aware, we've been through quite a significant organisational change recently. And Rob, myself and other exec leads were doing lots and lots of staff briefings right across the ICB where speaking up was always promoted. There are some national requirements for us. Our first quarterly submission to the National Guardian's Office will be this April, which will be a quarterly submission of our activity and learning. Section 4.3 of the paper does give you a feel of the activity. It might feel relatively low for this organisation, although, again, you could say, will that increase now we have a dedicated resource? But hopefully that gives you a real sense of the type of contacts that I've received in this role, and now, of course, more latterly, Jock. Some of those have been purely signposting. Often the trick and the skill, the importance about a Freedom to Speak Up Guardian is understanding what they can deal with directly and, more importantly, where they can signpost. So you can see, even when it was me, some of the contacts was very much around signposting people, either internally within the ICB and sometimes externally to other supports. Some of the contacts that were received, perhaps no surprisingly, related directly to our organisational change called the Operating Model Review. And that was more that people, and I guess with my Director of People hat on, I was able to support people to go to the right area for support from that. We have had some concerns about behaviours. One of them, two of them directly in relation to line management behaviour. One of them we were able to successfully facilitate through mediation. Another one has led to a formal investigation which will be concluded. So it just gives you a flavour that this is quite wide-ranging. That there was one that was very much what felt like a Freedom to Speak Up matter, but potentially relating to a matter of safety, which has been raised with a local organisation that we're now working very closely with. And as you can see, it says at the time of submission, the new Freedom to Speak Up Guardian has received a contact. He's probably had another couple since we submitted this report from that point of view. So Another part of our focus will be around training for all of our staff, all of us as ICB members of staff, but also those of us who are managers. And there's actually, as part of our statutory and mandatory training, there's a paper coming to our exec management team tomorrow, where I'll be obviously looking for support that freedom to speak up training actually will become part of the requirements at different levels for us to undertake training. And I guess the last thing for me to mention is that's very focused on the ICB. And then there's a question about what's our role within the system. At the moment, it's guidance. It's guidance to say within the next 18 months, particularly around the primary care workforce, there's questions around sort of making sure there is opportunity for people to speak up. And my colleague Jock was able to attend what was the first national round table between ICBs, between the National Guardian's Office and between NHS England, where there will be an ongoing discussion about what is our role as an ICB in supporting the speaking up agenda more widely. So for us, the next steps are internally. It's really about further promotion. We have some freedom to speak up champions within some of our places, but not in all. So I think there'll be a look at that. And of course, we will absolutely actively take part in this national discussion around that wider piece. So before I hand back, Cathy, I guess just a few comments, if I may, from Majid. Firstly, he says he's really pleased to see that there is a report that is an opportunity for we as a board to reinform our commitment, not just to the role of a guardian, but to some of the processes. He recognises that, he says, we undergo continuing significant change, both as an organisation and as part of the system. And this can bring out sometimes the best and the worst in terms of practice and behaviours. And actually having people such as guardians that people can reach out to is really important. Whilst we haven't got a huge number of contacts, obviously that might grow, which can be a positive thing in terms of some of the promotion. And it links to one of the comments that we've made earlier about staff survey. Let's connect this work in terms of broader feedback and themes to the results of our staff survey as well, which is absolutely the right sort of recommendation. So I'm going to pause there and happy to take any questions. Thank you.
Great. Does anyone around the table have questions? Fatima?
Not necessarily a question, more of a reflection. I mean, obviously, the Chief Executive report referred to the Too Hot to Handle work led by Roger Klein. There's obviously lots of learning in there that we as a partnership have responded to, and that's available in the public domain. I suppose I wonder, is there an opportunity to join the two together? Is my first sort of offer. The second one is, from my previous work as an Edina Trust, I am really mindful that sometimes people find it difficult to approach the Freedom to Speak Up Guardian because they don't know them very well, they may not share the same lived experience or heritage. And you referred to champions, and I suppose my question is there an opportunity for us to work with our staff networks to create a diverse range of Freedom to Speak Up champions across the system, and therefore role model to other organisations the art of the possible, so that it feels comfortable for anyone to come forward and speak to somebody with some skills and expertise?
Thank you, Fatima. I'm just going to take two more comments and then come back to you, Kate. So we've got AC, then Karen, and then we'll come back to you, Kate.
Thanks, Cathy. Thanks, Kate. A very useful summary. You have identified one of the key things is about sort of awareness in this particular. So I'm assuming there's a number of things that you're doing. And while you were sharing the report, I was looking at this lovely screen saver on the laptop for all employees. Perhaps something of that nature would be useful, adding a slide in there in which sort of members could immediately see in that who's the guardian, or on a web page where you can not only talk about the ICB but also information about if they're in a different part of the system, on how they can access that information, on what is the approach to sort of reach out to the freedom of the relevant pathways to speak up.
Thank you. So raising awareness of those guardians and those champions. Yes,
looking at this sort of screensaver approach, it felt like every employee or every member of staff should have that.
Yes, I agree. And for anyone who can't see these screensavers, if you're a member of the Integrated Care Board NHS West Yorkshire, on your laptop, I've got one in front of me now, is highlighting a variety of campaigns. So the one in front of me right now is Root Out Racism, for example. So thank you. I'm going to take one more comment from Karen and then come back to you, Kate. Karen.
Thank you. So I think these Freedom to Speak Up Guardians do a remarkable job for many of our organisations. They carry an awful lot, and we need to think about how we support them too. So that's one point. The other thing is I'm thinking about is how do we make a network of these and how do we help them to support each other? So we have, as well as a Guardian, we have champions throughout our organisation, and how do we use and get those colleagues to work together to support themselves, but also to learn as much as we can across the piece. Thank you.
Thanks, Karen. I think that links with perhaps what NHS England is wanting to explore. I'm quite keen for, there is a requirement for every NHS provider board to have a non-exec with the Freedom Speak Up Guardian remit, and I'd really be keen to get them together as well. Rob, do you want to respond? Then Kate, we will come to you.
Just to add a bit of reflection, so induction for all new starters. I meet all the new starters, and one of the things that I reinforce is our values and the way that we work around here, and the fact that people should feel able to offer ideas, advice and raise issues in their team and with their line manager or with any of the directors. And they have that permission direct from me and expectation that should be okay. And in all the organisations around this table, I'm sure the culture is the same. You want a compassionate culture where people feel able to say what they need to. And we talk about our values and we induct and recruit to those values so that people are in the right culture. And the Freedom to Speak Up arrangements are a safety net, aren't they, for when that doesn't happen and people don't feel like they've got anywhere to go. So I do think that the idea of maybe using the people plan and the action plan for the people plan, connecting this work to the work of what's coming out of the staff survey about do people feel safe to speak up, etc., so that we've got a range of actions that say, look, we're reinforcing a compassionate culture through our leadership. We're targeting areas where people don't feel safe to speak up, if we can identify any of those, and that we have this really good network of champions and the Guardian so that people can connect to somebody like them. And I do appreciate the offer that Fatima's making, because as Karen's pointed out, and I know from my experience, Swift has got the same kind of model with the staff networks. That can really, really help. But the fundamental point I want to make is this board has to help set the tone where it's just normal for people to speak up. And then there's the safety net. The safety net isn't the mainstream way of speaking up.
Thanks, Rob. Kate, you've got a variety of comments and suggestions there.
No,
Will you respond?
Firstly, thank you, and I appreciate I didn't take us through every section of the paper. If I start with the comms, and I should give a shout out to our corporate comms team who are already working really closely with Jock. Not just to promote, and there is, as it says in the paper, firstly a dedicated part of the website, dedicated contact centre, contact numbers and all those sorts of things. I like the idea of the screen save. It says here, obviously there is a national sort of Freedom to Speak Up month, so we've already got, with very proactive support, some comms already ready, even though that's not till the autumn. Jock's also, as part of his own induction, so thank you to Fatima, is meeting all of the staff network leads. He's already started to do that, including, and he's met with some of our EDI colleagues. But also he's doing some actually face-to-face. I think he's out with colleagues in Bradford tomorrow, to actually really get out and be seen, which I think starts to flag some of this. I think one of the key things is Karen's point about how do we then develop further. There is something here about we've obviously got to make sure that from an ICB point of view that we have that focus. But I absolutely know the next set of priorities then is what's the network around the system. And I have to say, one of the strengths when Majid and I interviewed Jock is his background is ambulance services. He was the first Freedom to Speak Up Guardian in the ambulance services and created the national network. So I've got every confidence that will be a real sort of not just priority for him, but quite a desire. So, all positive, hopefully. Thank you.
Kate, thank you very much. And I also note a request from Jock to the board via me is that we will undertake Freedom to Speak Up Guardian training as well as board members and include that as part of our own mandatory training as well. So, okay, we will do that. I think that's a very reasonable request, along with other training that we're looking at in terms of conflicts of interest. Kate, thank you very much for that report. We will track that. I know Rob has then suggested a connectivity with the people plan as well as what we do within the ICB. And I know you need to get going soon as well. Okay, thank you very much for that. Really happy to receive that. So we now have about 30 odd minutes left together, and we've got a number of reports to either receive for assurance or approve. Points for approval, documents for approval have been to other committees already, so I'm going to rely on Bev and Laura particularly to take us through these next items. So item 20 through to 23. We're going to take everything as read. And Bev, item 20, Emergency Preparedness, Resilience Response Annual Report received for assurance. Is there anything you want to highlight?
There is, Chair. So I've been asked by Anthony, who is the Director of Planning and Performance and Accountable Emergency Officer, to just draw out 4 things, if I may. So the really detailed report. It's the first annual report that the ICB is required to publish as in relation to our duties and responsibilities as a Category 1 responder. The first thing I want to draw out is the training exercises that have been undertaken. The report details the exercises that have been done in pages 4 to 6. We plan to introduce training portfolios to ensure that all relevant parties are fully trained to undertake key roles if required. In relation to the next point that I'd like to talk about is the learning and governance, which is under section 5. So we've taken the learning from all of the exercises that we've undertaken, and we've amended policies and procedures accordingly. We're currently reviewing all on-call policies to ensure that we've got a trained workforce that that can respond in the event of as a Category 1 responder, and also that we've got logists, trained logists and comms cover in all 24-hour periods. The third point is around the annual assurance. So the board will be aware that last November we received a highlight report that, like other ICBs, we weren't compliant with some of the standards following national changes, and a detailed work plan can be found at Appendix 3. We're working with trusts across West Yorkshire to ensure that these are delivered, and we anticipate that we will be fully compliant in the coming months. And then the final point, sorry, my voice is failing. The final point is around business continuity, which is on page 13. We've got a single policy that's been developed for business continuity, and we're working with each place and a directorate to ensure that that theirs are all being refreshed, and there's a business impact assessment being planned to prioritise any actions. And that's all I wanted to say, Chair. Thank you.
Thank you. So we take that report as assurance, and this is something that you've, Anthony has been reporting to us over a number of board meetings as well. So thank you. I can see nods around the table. Thank you. Okay, the next ones, we have 3 policies or statements to approve. Bev and Laura, can you give us an overview of each one, and then we'll approve?
Thanks. Yeah, I'll just take them in turn, just so I make sure I've got the approvals that I need. So the first one is the modern slavery statement. We are sharing that for board approval today. This is the ICB's first modern slavery statement. I won't go through what's in the report. It has been through Quality Committee en route through to here and was recommended for approval. Just the point I just wanted to make was that this is the ICB as a statutory body's statement. It is intended that further discussions are going to take place in the Partnership Board in July around the systems commitment to this work. Thank you.
Thank you. Just to, colleagues, are you happy to approve that statement on behalf of the Integrated Care Board? Yeah. Nods around the table. Thank you.
Thank you. So I'll just run through with the decisions that you're being asked to make on the next one rather than go through all the detail. So it's a number of amendments to different governance documents. The first one is that you've been asked to approve changes to the Constitution and to support an application to NHS England to make those changes. Second one is approving changes to the financial scheme of delegation and the standing financial instructions. And the third one is that you've been asked to approve changes to the terms of reference for the Pharmaceutical Services Regulations Committee. Thank you.
And Laura, where have this been before? They've been to the Finance, Performance and Investment Committee?
They've been, yes. Some have been to Finance, Investment and Performance Committee, and some have been through Remuneration and Nomination Committee, and then these are the subsequent changes that need to be made.
Right. Sorry, I feel like I'm interviewing you. Colleagues, are you happy to approve those documents, noting where they have been reviewed before? Okay, thank you. And next one's item 23.
Thank you. So this is the Standards of Business Conduct Policy. It's an important policy, forms part of the Governance Handbook, so therefore sits with the Board for approval. We did initially create this policy at establishment, so we've been able to learn over the last few months, and we've updated it. All the details are within the paper. It has been shared via email with members of Audit Committee, and that again is detailed in the paper. So I don't think there's anything other than asking for approval, please.
Okay. Colleagues, are you happy to approve this? Yes, okay. And we note, I've just mentioned it actually, managing conflicts of interest training module, as well as a reminder on the use of our portal and keeping declarations live and up to date. Okay, thank you colleagues for moving us swiftly through that. Okay. Our next item are the committee AAA reports, and as board members know, we move these around the agenda, and the aim is, if it's at the end of the agenda, we have aimed throughout the meeting and through the reporting in the agenda to have covered key items. So you have AAA reports there from all our place committees. The Leeds one arrived yesterday, and from our ICB West Yorkshire level committees as well, with audit also coming through to you. There are a number of themes there, and particularly on financial management for 23-24 and into the new financial year as well, which has been a common theme for us. Is there anything exceptional, anything that's changed, or anything to escalate urgently from any of those committees for us to note? Ruth?
It's probably just worth noting that we have had a subsequent meeting of the Wakefield District Health and Care Partnership that's not included in here because of the timing, but the decision around the Pontefract midwifery-led unit was reversed following some further conversations that we had with overview and scrutiny. So it's reported from January as being the decision of the committee, but it no longer is.
That's helpful, and I know board members have had a briefing, particularly on this, and we're grateful to you. And that links in then with the report we've just had from Bev on maternity services as well. We're aware of that. Anybody else? Nancy?
Yeah, just on a similar note, the financial position at Bradford Council, as Robin has alluded to, has changed, so that risk has now gone down back to a 20 from a 25.
Jane?
Yeah, thanks, Kathy. So the audit committee ones came out late, so it's not in the main pack, but were distributed yesterday. I guess there were two things in the alert section, one about internal audit. I'm really just going to focus because I think the next time we meet, we'll have made quite a bit of work in terms of the next year's audit plan. So rather than stress the point about completing this year's audits, just to sort of ask colleagues who are involved and will be exec sponsors of audits for next year's plan, just encouraging everybody to engage in the sort of phasing of when those audits will take place and your commitment to that. We will be trying to sequence so we have a smooth phasing of audits during the year that can come through to the committee. That is often not what happens, and by the end of it we end up with quite a lot still to come through, which is exactly where we are at the moment. But so if I can just ask colleagues, please can you work with the internal auditors, and when you do sign up, stick with it, please. We won't be able to sort of box and cox and move things around. It gets very congested. So your help in that would be appreciated. And on Laura's behalf, maybe the data security protection toolkit. Colleagues probably will be aware through other committees or conversations about new requirements within that toolkit that we need to be compliant on. Quite a lot of work is required to make progress on the new one. And anybody who's being chased to adapt to the new measure, that would be much appreciated. Thank you.
Okay, thank you for those messages from the audit chair and those requests. And if anyone wants further information, please contact Jane or Jonathan. Okay. So those are our AAA reports, and then board members, you're aware that you also have access to the minutes of those committees as well if you want to dive into any of those detail, either if you're a member of that committee or you're interested in another committee. So thank you for all that information. It is really helpful to us. So we're now on to any other business. We have got two items here. One is an urgent decision notice in relation to our 2023-24 financial year, and the second one is on the mental health investment standard. I'm going to hand to Jonathan on the first one on the urgent decision notice. Thank you.
Thank you, Chair. And hopefully people will have seen the paper that came round last week, and I think all board colleagues were invited to join Kathy, myself and Jane too when we had the meeting last week. So just for, because I'm conscious that there is the potential for that the decision to be sort of slightly misunderstood. So before I go into the decision, if I just explain the context, if I can just briefly. So as I said earlier when I presented the financial position for month 10, we are forecasting to deliver system break-even this year. That's composed of a surplus in the ICB and a combined deficits in NHS providers, and the two things net off together to give a balanced position. And what the decision notice that Kathy's alluded to that's been sent round basically redistributes that surplus from the ICB into providers. There is no more spending power for providers, there's no more money. It just reallocates our position. So rather than ending with broadly a 25 million surplus in providers and 25 million deficit a 25 million surplus in the ICB and a 25 million in providers, they're broadly balanced. So the ICB is broadly at break even and providers combined are broadly at break even, and that's what it does. It's not new money, it's not new spending power. There are some bits of context, so just the context is by way of reminder. The reason why we ended up as an ICB with a £25 million surplus at the start of the year is we agreed as an ICB to take on £25 million worth of system risk when we signed off our financial plans. So the intention, it would be unusual for the ICB to set off at the start of the year with a planned surplus. That would be an unusual thing. We were at that position because we agreed collectively as a system that the system risk will be held within the ICB, and the idea was that would be balanced out as providers improve their positions in year potentially. So that was never our intention, although it was our plan. It's worthwhile just recognising that NHS England about a month ago provided financial support to all ICSs who started the year with a planned deficit. So 0.7 billion went out to a number of ICSs across the country with a suggestion or an instruction that money should be passported to providers to cover cash issues in providers. And in some ways there's a bit of an analogy with what we're doing locally, I think. So I suppose
just for that, we're not in that list.
We're not in that list. Sorry, we're absolutely not in that list. I'm just drawing an analogy between what's happened there and what's happened with us. As an ICB, we don't have our own bank account. We don't manage our cash in the same way as providers do. Providers do have their own bank accounts. They can go into overdrafts and they're required to borrow, and they're required to borrow at a cost. So there's no point in us as an ICB sitting on cash balances. So that was another reason behind this. I did, obviously, and I think this is important for the board, confirm with NHS England whether there would be any regulatory impact of us not delivering our plan as an ICB, as one standalone body in West Yorkshire. The answer was no, as long as the system balances, because system balance is seen as taking precedent. I also confirmed that our external auditors would not have an issue with this approach, and they confirmed that they wouldn't. So we went through a number of iterations with the finance directors about how we might transact this. There were, as you'd expect, a number of different views. We got to a position that was fair and defensible and reasonable, and colleagues could get behind. And that was the decision that was brought to Kathy and myself and Jane last week. The key decision, I'd say, for the board, there's an interest in where the money goes in terms of the 10 providers. The key decision for the board, though, is around, does the board support not delivering our financial plan in 23-24 and passing £21.4 million to providers? And that's the decision that we made last week, that I think is brought for ratification today. Yep. So I know it might be labouring the point slightly, but it is important that people understand the context and what this is and what it isn't.
Thank you. And that's amongst the 10 NHS providers in West Yorkshire.
It is. It's actually to a smaller number, but the principle was to the provider.
Applied to them.
Yeah.
Richard.
Thank you, Chair. I mean, one of the themes of this meeting has been about improving communication. And I think this decision needs to be communicated very, very carefully because it will be perceived by primary care providers that secondary care providers are being bailed out yet again at the expense of everybody else, ultimately them. And that's not what's happening. So I think we need to be very clear about what is happening and what isn't happening, so that those in other sectors, particularly primary care, voluntary sector, elsewhere, don't perceive that this is business as usual as they understand it, because I think that understanding is very well entrenched over many, many years.
Richard, that's really helpful, and great, Karen, I'm grateful to you for coming as a board member to observe the session and ask a very similar question as well. And I think this is helpful for clarification and messaging as a board, and also, as you say, as we take that out to health and care. Jane, is there anything that you want to comment upon? No, but thank you for being part of that process. So, colleagues, we're asking you to ratify this decision. I also want to note, Brendan, thank you. You emailed some comments in support of the proposal, and we also received some comments from Tom Reardon on behalf of local authorities. Similar theme to what you've shared, Richard, and also that Karen shared as well, thinking of the broader health and care and all the different sectors and bodies that make that up. But, colleagues, are you happy to ratify that decision and support it? Thank you. Thank you, Jonathan. Again, I am really pleased that we've met our statutory duty to deliver a balanced budget for 2023-24. It is phenomenal achievement when I think about where we were at certain points. So thank you very much. It's a fantastic achievement. We now move on to the Mental Health Investment Standard. Jonathan, you're going to talk us through some key figures, is that right?
Well, I think it's more the principle, to be honest, Cathy, at this pace. So there's so we're required to engage an independent review every year of our mental health investment standard compliance. We do that with KPMG, so it doesn't form part of our statutory external audit. It's an independent review. That process is being concluded for 22-23. And the papers that have been brought to the board today are twofold. One, a statement of compliance, which requires Rob's signature as Chief Exec, and the other, a letter of management representation, which again requires Rob's signature as Chief Exec. I should point out that there is a slight restatement of the numbers that are contained in the statement of compliance. Those numbers don't change the material conclusion, which is we exceeded the amount of money that we're required to spend on mental health investment standard. We'll make sure that those are included in a note that's circulated afterwards. So really it's just for just to get the board's assurance that there are no issues that would preclude Rob from signing those two documents.
Jane.
Sorry, this is a point of clarification for my sake, Jonathan. So we got it at Audit Committee as well on Friday.
We have.
So presumably timing-wise, we're covering it today, is that right? In expectation that we've had the review at Audit Committee?
Yes, so as soon as KPMG assuming that there's no issues today and Rob's able to sign those two documents, the audit, the independent review will be able to conclude it on Friday, and KPMG will formally respond to us within the next day or so.
Colleagues, are you happy to support that decision and proposal? Yeah, okay. And then we note that's coming to Audit Committee later this week. Okay.
Thank you.
Thank you, Jonathan. Laura, I think we've covered everything, which I'm really pleased. Now, before we finish our board meeting in public, I've just got a few things to share. One, that we will be looking for a new Race Equality Network representative to come as an attendee and advocate for the network, which we're working with Fatima Khan-Shah on, which will work alongside her West Yorkshire Inclusivity Champion role. So that's an action for me to take forward with Fatima. She isn't here today, but this would have been Karen Coleman's last board meeting with us before her retirement at the end of May. She's on holiday at the moment, so I wanted to, on behalf of the board, thank Karen for so many things she's done, probably being part of the birth of the partnership in this very building many, many years ago. Many of you've worked with her over many years, and she is fabulous. So thanks from me as chair on behalf of the board to everything that Karen's done for our partnership. And then a reminder to you that we're going to now move into a new cycle. So April, we're going to have an ICB board development session. May, we'll have time when I'll be encouraging you to go out and do engagement with services and visits and leaders, and also to go and share best practice with other systems and providers as well and report back. And then June, we will have our board meeting, 25th of June, Bradford District and Craven area will be going to have our next board meeting. And we'll have a theme of tackling inequalities as well as a follow-up on a number of things, including on primary care. So, colleagues, thank you for your time, your contributions, your preparation, the people who are not here who prepare as well, and thank you for anyone who has taken an interest in our work as a board. And that's the conclusion of our March board meeting. Thank you.